Prostate cancer can develop either due to sexual underactivity. For example, something I've often observed in patients: you served honorably in the army, then you served diligently as a father, and then you were completely done serving. Or alternatively, you can acquire this particular disease from excessive sexual overactivity. For example, men in certain professions, doctors, lawyers, journalists, or even brokers, they're always under pressure, always under stress. These are also usually the professions where domestic violence is most common, right? They come home with all that pressure, and if the wife isn't available quickly enough, bang, just like that, someone ends up with a swollen face. Maybe you should consider finding a different job. That's also where the risk of prostate cancer is noticeably high, unusually frequent. People affected, those who are always under a lot of pressure, as well as those with underfunction. You can check out the segment on impotence again, the one with the thermos, right? That might help. If you're already undergoing treatment, you can also take D-mannose sugar. Because cancer loves sugar and hates vitamin C, and with D-mannose you become more receptive to chemotherapy. Yes, there have even been attempts to have patients go completely without sugar, simply to starve the cancer. That's nonsense. Please, if you are undergoing chemotherapy, take this D-mannose sugar. You can get it at any drugstore. You take this sugar, which is a simple sugar, 3 times a day from the first to the third day, twice a day on the fourth and fifth days, and then only once a day from then on. Alternative healing methods do not replace conventional medicine, but you can include them because they do no harm. However, we distinguish between allopathy, conventional medicine, and homeopathy. In addition to conventional medical treatment for prostate cancer, anthroposophic medicine has also proven effective, specifically with the subcutaneous injection of mistletoe extract. As a significant result, in combination, the tumors have also noticeably shrunk. Here's what else you can potentially take alongside therapy that effectively kills cancer cells, thoroughly inhibits cancer cell growth, actively prevents cancer, and completely stops metastasis. You can read all about this in the newspaper under the chapter Cancer, even if you have a malignant, inoperable tumor. There you'll find a very informative article about the Clinica Santa Croce in Switzerland. To prevent cancer, you can simply go to your family doctor once a year. Have them do a comprehensive blood test. Submit your morning urine and have a CEA tumor marker test done. This is a non-specific tumor marker. It can show whether there is something present within your body that truly doesn't belong there. Of course, there are also specific tumor markers. If you're particularly concerned about breast cancer because it runs in your family, then have the corresponding tumor marker tested. Then talk to your doctor again. This CEA tumor marker test costs 14 euros here in Germany, and you should consider yourself worth it.